have been using the UltraPulse for at least 8 years. We use it for a number of indications. A lot of it for hypertrophic scarring, for skin rejuvenation, for acne scarring. And we have started also using it for some radiation fibrosis as well as a new potential treatment for radiation injury. So we do combine the UltraPulse treatment with other modalities depending on what kind of scars we are looking at, whether it's hypertrophic or atrophic, whether it's radiation scar, whether there's significant amount of telangiectasias. So most often for hypertrophic scar, we combine that with using topical triamcinolone, at least 40 milligram per ml, and apply directly on top, or we can even use clobetasol gel in the past for hypertrophic scar with really good results. We have also combined the use of fractional CO2, the UltraPulse with a pulse dye laser, as well as a new process where, particularly for radiated patient, to combine the UltraPulse with epidermal grafting of skin on top of this radiation scar. And the epidermal grafting basically is the creation of small little suction blisters, and then transfer that onto the disease area to replace the epidermis. And we actually use the Active FX handpiece on the UltraPulse to remove the epidermis and then subsequently transfer the suction blister on top of that area and create a really nice wound. I actually really like that technique. In terms of anesthesia for UltraPulse treatment, we do actually use the different combination depending on the patient and where we are at. For children, we like 7% lidocaine ointment applied for at least 30 to 60 minutes prior to treatment options. We have also used a combination of benzocaine, lidocaine, and tetracaine. It's called BLT for apply at least 45 to 60 minutes prior to treatment. I also actually have patients who don't prefer any anesthesia if they have to do injection anesthesia, which we do sometimes. We sometimes also do nerve block. But some patients actually find that, if you have to do injection anesthesia, it hurts more. So they just prefer not to do anything. And they don't think it hurt that much. It's a little discomfort, and they were fine afterwards. In terms of downtimes, patients do usually complain of downtime. We usually warn them it can take between 3 to 7 days for the skin to completely heal. And we give them a regimen of sheets of how they can do soaking at home to prevent infection as well to help with the healing process. However, most patients tell me after 2-3 days, all their wounds are healed. They don't have any open wounds anymore, and it's very well tolerated. In terms of the evolution of the scar after treatment, usually the remodeling process, I actually warn patients, can take anywhere between 1 to 3 months. So we don't always expect that the improvement of scar will happen immediately. However, a lot of our hypertrophic scarring patient, and we see this over and over again, and even in some of the radiation dermatitis patient, if we treat an area that's shown to be improved, the improvement usually start about 2-3 days after treatment, which is really amazing. In terms of the short pulsings of the UltraPulse, they're contributing to the effectiveness of the laser treatment. I think that definitely has a component in terms of helping the scar. I do like the UltraPulse a lot. I think the ease of use is really great. It has an ability to, you can do large or small area, you can do different shape and sizes, you can very tightly control which area you can use, and you can increase the densities that you need. And I love the device. I think it's great. So definitely would recommend it to other people.